Okay, so now we're going to discuss some of the pertinent structures of the trunk. What I have in front of me here is the sternum, and you can see the costal cartilage coming off the sternum in each one of these areas. So we have, as you recall, we have 12 ribs, which lines up with the vertebrae that we have as well. There are certain sections of the sternum that I want you to be aware of. Number one, we call this particular area, this bony structure, the manubrium. So the manubrium is also analogous with the handle of a sword. So if we turn this thing upside down and we hold it like this, you can see that it sort of looks like a sword. So we call that handle the manubrium. Now on the manubrium we have a couple landmarks that we should really become familiar with. We have the jugular notch, which is right here, and then we have the clavicular notches on the superior aspect, where obviously the clavicle is going to come in and articulate with the axial skeleton there. We consider this section the body of the sternum. And this little junction right between the manubrium and the body, we call this the sternal angle. And if we turn it to the side, you can see that it actually does have an angulation to it. So easy to remember that that's our sternal angle. And if we continue along posteriorly, this little knobby structure right here is called our xiphoid process. So our xiphoid process, and you'll remember that from CPR. This is what we're attempting not to fracture when we're performing CPR, so that we can maintain the safety of the patients as we're administering the CPR. So that's where it gets a little bit of popularity, if you will. We also have rib structures that we'd like to discuss. So the rib, this is a rib. This would now be the superior aspect of the rib. This here would now be the inferior aspect of the rib. And this is a typical rib, also known as ribs 3 through 10. We'll discuss at least one of the non-typical ribs here. Now, I know that this is the superior surface mainly because when I look underneath, I'm going to zoom in for you here, you can see this little line, almost like, well, that line we call the costal groove. Be pertinent to really feeding the area with blood vessels. So this is where important blood vessels are going to lie. So I know that that costal groove is on the inferior aspect of the rib. So I can use that to determine which way is superior and which way is inferior on this particular rib segment. Now this end here, closest to you in the camera, this is what we'd call our costal articulation. So this is where we're actually, the rib is meeting up with the costal cartilage and eventually connecting in with the sternum. We have some other landmarks primarily on the posterior aspect. So I'm going to reorient you. Now we're looking closer at the posterior aspect of this rib. And we can see the head of the rib. This is going to articulate with the transverse processes and the vertebral body of the thoracic spine. We have a tubercle here. This again is going to have some articulation point, and if I just turn it a little bit this way, you can get a better view of the tubercle here. So we have the head. This is then the neck, the tubercle, and then the angle is right here where we start to see a dramatic change in the orientation of the rib segment. Okay, so then the rest of this we'd consider the shaft then, the shaft of the rib. So those are the aspects of the rib that I want you to pay attention to. Now we have one specific rib that deserves a little bit of extra attention. Here it is shaped here a little bit differently than what we had seen with the other typical rib here. So this is our first rib. So this is the very start of our rib cage. And again, we can identify some structures here that we've already talked about: the head, the neck, and also the tubercle. Okay, so those are very consistent. What you're going to find on the first rib, though, are a couple extra structures. This bump that kind of juts out right here, we call that the scalene tubercle. So this is where the anterior scalene is going to insert. So this little bump is a key landmark because anterior to that, which would be this direction, so anterior in this little depression, this is the groove for the subclavian vein. Okay, so anterior is the subclavian vein, and just posterior to the scalene tubercle would lie our subclavian artery, and also the lower trunk of our brachial plexus, which we'll talk about later this semester. Okay, so if you think back to our discussion on the circulatory system, the vein is a little bit, the subclavian vein in particular, is a little bit anterior to the subclavian artery, so we can remember that our grooves are going to follow suit. So we have subclavian groove for the subclavian vein, scalene tubercle, and groove for our subclavian artery.